Assalamualaikum and a very good morning to our respected lecturer, Dr. Hana. So today we're going to present to you about chemotherapy. And our group members are Nur Elisa Anis binti Azmi, Nur Alia Umairah binti Muhammad Faisal, Muhammad Khairul Nizam bin Imran, Muhammad Razik Daniel bin Muhammad Hilman, Nur Aiza Fazira binti Zamri, and last but not least, Muhammad Rifki bin Muhammad Hafiz. In these slides, we included the introduction of chemotherapy, the history of chemotherapy, the use of chemotherapy in lives, the advantages of chemotherapy, the side effects of chemotherapy treatment, and conclusion. For introduction, chemotherapy is a drug treatment that uses powerful chemicals to kill the fast-growing cells in human body. It is usually used to treat cancer as the cancer cells grow out faster than the other cells. How chemotherapy works? It is dividing the cells in human body. As the human grows up, most of the cells do not divide and multiply much, and they only be divided if they need to repair the damage. After that, chemotherapy can shrink tumors or keep them in check until they can be removed surgically. It is more often than not used in conjunction with other treatments. There are many advantages of using chemotherapy as a treatment to kill the cancer cell, but everything has its cons too. We chose this topic because we thought that the chemotherapy is one of the great inventions that have been used to save many lives of cancer survivors in this world. Because of that, we want to explore more about chemotherapy treatment and share it with others.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Alia Umairah binti Muhammad Faisal from Group 4 of E30, and now I'm going to be talking about the history of chemotherapy. The development of chemotherapy started with a discovery found during World War II. While researching for treatments for victims of chemical warfare from the previous World War, scientists discovered that soldiers exposed to nitrogen mustard lost a significant number of white blood cells. This led to an investigation if this chemical could be used to stop the rapid growth of dividing cells such as cancer cells. In the 1940s, Alfred Gilman and Louis Goodman examined the effects of mustard agents in treating lymphoma. They injected a less volatile form of mustard gas called mustine, which is also still nitrogen mustard, into a patient who had non-Hodgkin's lymphoma. The scientists found that the patient's tumor masses were significantly reduced for a few weeks after treatment, and even though the patient still needs to receive more chemotherapy after the first treatment, this marked the beginning of the use of cytotoxic agents for the treatment of cancer. The results of this study was published in 1946. Now, after World War II, a pathologist from Harvard Medical School named Sidney Farber began to investigate another chemotherapeutic approach. He studied the anti-cancer effects of folic acid, an essential vitamin in DNA metabolism. Farber and colleagues developed folate analogs such as methotrexate, which they found were antagonistic to folic acid and prevent the actions of enzymes that required folate. In 1948, these agents became the first lead to remission in children with acute lymphoblastic leukemia, showing that antifolates had the potential to restore normal bone marrow. Over the next 2 decades, various combinations of chemotherapy regimens started to gain popularity. The coexisting use of drugs with different mechanisms of action led to the further improvement in patient survival and to a decline in mortality rates, which have declined each year from 1990 until now. This fall in death rates is due to both early detection and treatment with chemotherapy agents.
Hi, I am Muhammad Khairul Nizam bin Amran, and I will present about use of chemotherapy in life. Chemotherapy drug or anti-cancer agent are the main treatment for cancer diseases such as leukemia, lymphoma, and breast cancer. Therefore, cancer patients still have the opportunity to continue living with the presence of this method of treatment of chemotherapy. Then, this drug is used to treat cancer, prevent cancer from spreading, slow the progression of cancer, and to kill the cancer cell that spread to the other parts of body. Chemotherapy can be used alone for some type of cancer or in combination with other treatments such as radiotherapy and surgery. With this method, tumor or cancer can be cured and provide a solution to patients with cancer. Next, the rate of cancer sufferers can also be better controlled. Chemotherapy drugs are toxic to the cancer cell. This drug acts by preventing cancer cells from dividing and multiplying. Finally, cancer in patient body can be eliminated slowly.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Razif Jinai bin Muhammad Himan, and I am about to tell you guys about the advantages of chemotherapy. First of all, chemotherapy helps to shrink the cancer tumor or slow down its growth. Chemotherapy does not kill off the whole mass of the cancerous cell at once. The best that it can do is to control the mitosis of the cells. Second, having chemotherapy after surgery reduces the chances of cancer from coming back. For your information, chemotherapy is a therapy that uses a radiation of high frequency. This radiation is concentrated at a certain point, which is at the cancer tumor. Number 3, remove any remaining cancer cells after radiotherapy or surgery. A surgeon's hand is indeed a human hand. They are unable to precisely remove the cancerous cells. Therefore, there is a chance that the cancerous cells will become active again. Number 4, slow down disease progression and prevent recurrence. Chemotherapy might not be able to kill all the cancerous cells at once, but at the very least, the cancer cells will remain inactive after the treatment. And number 5, reduce symptoms in the later stage even if a cure is unlikely. In a very invasive cases, cure is unlikely. However, symptoms can be reduced, resulting in a better quality of life, although the initial quality of life is impossible to restore.
Side effects of chemotherapy. Chemotherapy treatment causes a lot of side effects. However, some of these side effects can be treated by consultation with the doctors, and some of it will disappear by its own. The first side effects that I wrote here is mouth and throat sores. Mouth and throat sores happens when there is a condition called mucositis. The second one here is diarrhea. The third one is nausea and vomiting. The fourth one is constipation. So the constipation here means not having a bowel movement often enough or having difficult bowel movement. The fifth one is blood disorder. Blood disorder is basically because our bone marrow is the spongy tissue inside our bones. It makes new blood cells. So when there is a problem with that, we might have a side effect from having too few blood cells. Next is changes in thinking and memory. Some people have trouble thinking clearly and concentrating after chemotherapy treatment. Cancer survivors often call this as chemo brain. And the last one here is long-term side effects. So long-term side effects means permanent damage to the heart, lung, liver, kidneys, or reproductive system. So here is some other side effects that I have listed, such as nervous system effects, sexual and reproductive issues, appetite loss, and hair loss.
So as for the conclusion, chemotherapy treatment can treat cancer cells that spread all over the body, but it has a negative side effect to the body patient. So the example of negative side effect to the body patient is it can cause a nausea, vomiting, constipation, fatigue, hair loss, and anemia, which is blood loss. So next, chemotherapy treatment also help in surgery by removing the tumors easily. So in surgery, the chemotherapy treatment can help the human cell to divide and prevent the cancer cell from dividing and multiplying. Uh, in general, we can say that this treatment can help to prevent the cancer cell from spreading from another part to another part of the body. Next, chemotherapy also can reduce the percentage of cancer infection in the body patient. After the surgery, when we have a chemotherapy treatment after the surgery, it can reduce the chances of the cancer cell from coming back to the body patient. And lastly, most detailed studies in the chemotherapy treatment need to be done. By doing that, we can overcome all the negative side effects of this chemotherapy treatment and make this treatment more effective and safe to the patient that had a cancer. So that's all from us. Thank you.